Hi everyone. Today I wanted to talk about hot flashes. Most people think hot flashes are annoying and inconvenient, and they are, but they're also a clue as to what's going on with your heart. So much so that the American Heart Association has called hot flashes a female-specific risk factor for cardiovascular disease. So let's talk a little bit more about it. Hot flashes are a result of fluctuations in estrogen level, and most women have them, if they're going to have them, in midlife. They can be a sign of what's going on with the underlying blood vessels. So hot flashes are associated with an adverse cardiovascular risk profile. So they're associated with elevated LDL, elevated blood pressure, elevated blood sugar. However, even when they correct for the blood pressure, cholesterol, and blood sugar, the risk is still persistent for hot flashes and cardiovascular disease. It seems to be associated with both severity and frequency of hot flashes, and frequency in this case is defined as 6 hot flashes in a period of 2 weeks. Severity, there's not really a scale, but most women can tell you if their hot flashes are severe or not. And it's totally independent of estrogen level. So, severity and frequency of hot flashes can impact cardiovascular disease, and women who have those are shown to be at increased risk for cardiovascular events, both heart attacks and strokes over time. So it is important, if you have hot flashes, to make sure that you're getting your heart disease risk assessed and monitored regularly. The next question is, what about hormone replacement therapy? So hormone replacement therapy will alleviate hot flashes. It will not make cardiovascular disease worse. The jury's still out on whether it's protective for cardiovascular disease, so hopefully we'll have some answers on that in the next couple of years. So remember, don't ignore hot flashes. They're a sign of something going on underneath in your heart. Again, they think they're associated with blood vessels in the heart. And so one purported hypothesis is that the vessels are thicker and stiffer, and so that's affecting both hot flashes and the heart. And another hypothesis is that your blood vessels already have a little bit of plaque in them, and that's why it's contributing to both hot flashes and heart disease. If you have any further questions, let me know in the comments, or I'm giving a webinar on perimenopause coming up soon. It's totally free to attend. You can register at the link in the caption.